Hi, this is Monica, and today I'll be doing my presentation on coconut oil consumption and cardiovascular disease risk. First, I wanted to talk to you about why I chose this topic. I personally have a connection to heart disease. Multiple family members of mine have had heart attacks, strokes, and in particular, my dad has prolonged hypertension. And about 2 years ago, he tried the Mediterranean diet and he saw a significant improvement in his weight as well as his blood pressure. However, today I will be talking about coconut oil and how it relates to cardiovascular disease. Coconut oil itself is a highly controversial topic, as well as it is applied in many different types of settings, such as hair, skin, and cooking. So first, I'm going to share my screen. So the most common form of heart disease is coronary artery disease. Heart disease encompasses many different types of illnesses and conditions such as peripheral artery disease, myocardial infarction, high blood pressure. However, coronary artery disease remains to be the number one type of heart disease found in the United States. Approximately one person dies every 36 seconds from heart disease, contributing to 655,000 deaths annually. Now, this number is astounding because there are many different types of chronic illnesses in the United States. We have chronic kidney disease, diabetes, cancer. However, heart disease still remains to be the number one killer and having the highest mortality rate in the United States. Heart disease is more prevalent among certain disadvantaged groups such as Mexican Americans, African Americans, and American Indians. And one of the reasons is due to their poor dietary habits, specifically since these groups are of low income status and can't afford fresh and nutritious foods, and therefore resort to high caloric foods such as fast food, soft drinks, and chips. And also, I wanted to note the recent rise in premature deaths related to cardiovascular disease, particularly those who are 30 to 54 years old, where it is labeled as the prime years. And this is something I observed while working at a hospital. I noticed I was distributing heart healthy plans to these age groups. And, they were undergoing heart surgery or they are recovering from a heart attack. And normally this isn't something we see in, younger populations. And normally we associate chronic illnesses with older populations, such as those who are in their 70s, 80s. However, while we will be seeing a rise in chronic illnesses due to the aging population, we should be also focusing on the younger population, how they're also contributing to this prevalent public health issue. So a little bit about the history of coconut oil. Um, there's no exact date on when it was discovered. However, it's referred to as the tree of life in some cultures, specifically in the Pacific Islands. In a Samoan culture, it is called lolo, and this is due to its multiple uses such as for skin, hair, and cooking. And then in the 19th century, the demand for coconut oil increased substantially, making it a prominent staple in one's diet, and became one of the most traded commodities in the 20th century up until the 1950s. So the decline of coconut oil was due to the discovery of how it has saturated fat in it and how saturated fat relates to cardiovascular disease. And this was discovered by the famous American physiologist Ansel Keys. He also noted how a diet low in whole grains, fruits, and vegetables also contributed to heart disease. So there are two different types of coconut oils, and it's important to distinguish both because if you were to apply this to a clinical setting, or if a patient had asked advice on whether to use coconut oil, it is important to note the differences between both. So first, hydrogenated coconut oil is the most cost-effective option, and therefore it is bought more than virgin coconut oil. It is also more shelf-stable, meaning that it lasts longer, and also when you apply a heating system to it or you add heat, it changes an unsaturated fat to a saturated fat due to the change in it also well it changes an unsaturated fat to a saturated fat while also changing the bond formation from a cis to a trans formation, which makes it more unhealthy. Next, virgin coconut oil is obtained from fresh mature kernels. It does not use heat or chemical refining and has been shown to reduce total cholesterol, LDL cholesterol, and improve HDL cholesterol. So the composition of coconut oil is mainly saturated fatty acids. The top three that are found in coconut oil is caprylic acid, capric acid, and lauric acid. And lauric acid constitute as the major saturated fat, while the other ones, as seen on the left in the picture, are mainly medium chain triglycerides. And lauric acid, among other long-chain fatty acids, have been shown to have a direct effect on LDL cholesterol. And it's also important to note that the combination of fatty acids can influence our overall health, and that we should not be focusing on one fatty acid, but what our diet looks as a whole and consuming on a daily basis. So for coconut oil and CVD risks, um, it is recommended by the American Heart Association, that we replace saturated fat with polyunsaturated and monounsaturated fat, with more emphasis on polyunsaturated fat because there's more research done on that. It was also observed that coconut oil and palm oil have the highest amount of saturated fat, where coconut oil was at 82%, and this number is may be specifically astounding to some people and may deem away from using coconut oil in general if they were to see this number. And one study observed the effects on virgin coconut oil with metabolic syndrome patients, and I just want to emphasize why I chose this study. It's because metabolic patients or metabolic syndrome patients have certain cardiometabolic risk factors such as an elevated lipid profile, insulin resistance, and high blood pressure. And it was just interesting to see how the use of the coconut oil elevated the triglycerides, LDL, and AMDA, which is a predictor of atherosclerosis, with supposed to say coconut oil consumption. As I mentioned earlier, lauric acid is the predominant medium chain fatty acid in coconut oil. It biologically acts as a long chain fatty acid. This means when digested, the fat connects to or is attached to a chylomicron and then is distributed to various tissues in our body. And this means it can have a direct effect on our cholesterol levels or biosynthesis. And a meta-analysis was done, meaning a compilation of studies, and it was found that lauric acid was one of the saturated fats to raise LDL cholesterol overall. And if we were to recommend advice to patients, specifically those who have had strokes, diabetes, and myocardial infarctions, or those conditions that need to limit the amount of fat in their diets, it is difficult to implicate whether to give reasonable measures for these populations because just for the controversial, well, itself being a controversial topic, and the fact that there's limited evidence on whether it is beneficial to these populations. In terms of coconut oil and cardiovascular disease health, it is shown that coconut oil can improve HDL cholesterol. As I mentioned before, coconut oil is rich in medium chain fatty acids, which are metabolized differently than long chain fatty acids, meaning that it does not go to various tissues. The fat is brought directly to the liver, meaning that it does not have an effect on cholesterol homeostasis. One study found the effects on coronary artery disease patients when consuming sunflower oil and coconut oil. And it was found that the results showed that coconut oil did not induce hypercholesterolemia when compared to the sunflower group. Then another study did the same thing on 9 healthy men who consumed a healthy diet, and it also showed that there was an effect on HDL cholesterol, meaning that it increased, and it did not increase LDL cholesterol when consuming virgin coconut oil. I also wanted to mention how virgin coconut oil has also been used in obesity management. And as we know, obesity is a condition related to heart disease. As we know that obese patients have an elevated lipid profile and they're advised not to consume a lot of fats. And there's been previous research that has been shown that the consumption of medium chain triglycerides can increase energy expenditure and improve weight management. And one study particularly found 15 women with excess body weight that consumed virgin coconut oil, and there was no effect on their overall energy metabolism, fat oxidation rates, and cardiometabolic risk factors. So in conclusion, heart disease remains as one of the top killers in the United States, and it's still recommended that we replace saturated fat with monosaturated fat and polyunsaturated fat, with more emphasis on polyunsaturated fat due to more research on that. Coconut oil is still a popular product today, and due to its multi-versatile properties, and the type of coconut oil, such as virgin versus refined, can have an effect on our physiological functions in the body, specifically cholesterol homeostasis. Coconut oil, specifically virgin coconut oil, has been shown to have profound effects on our lipid profile, such as improving HDL, while lauric acid, on the other hand, serves as the predominant saturated fat in coconut oil and has a negative effect on our body and has been shown to raise LDL cholesterol. Therefore, advice on recommending coconut oil as a cardioprotective measure is limited and often controversial, and it's also often warranted, especially if we were to apply this to certain populations who need to limit their amount of saturated fat and overall fat in their body. This concludes this presentation. If you have any questions, please feel free to email me, especially if it relates to coconut oil. I'd be happy to see what you guys have to say. Thank you.